from the Legislative Building in Regina. We have Premier Scott Moe and Dr. Shahab, Saskatchewan's Chief Medical Health Officer. Joining us on the line, we have Scott Livingston, SHA's CEO. We'll start with an opening statement from the Premier and Dr. Shahab, and then we'll take questions. Premier?
Well, thank you very much. Good afternoon, everyone. Thank you for joining us here today. Today we are reporting 2 new cases as well as 9 additional recoveries. This is the 18th day in a row that the number of recoveries has exceeded the number of new cases, and the number of known active cases is now down to just 61. That's good news, as we are now well into Phase 2 of our Reopen Saskatchewan plan, and we are moving toward Phase 3 on June the 8th. And it shows that we are able to safely reopen our economy while at the same time we can continue to control the spread of the COVID-19 virus. While Saskatchewan people have proven that we can reduce the spread of COVID-19, this week we were reminded that the risk has not gone away. Sadly, there have been 3 additional deaths this week due to COVID-19, and a new community outbreak was declared in Saskatoon, which was the result of a couple of large family gatherings. And it's a reminder for all of us that we need to remain vigilant. We all have to keep physical distancing, continue to wash our hands, and follow the public health orders. Even if we are having a barbecue or a family dinner that's under the 10-person limit, we still need to be so very careful. Don't be touching the same food or drinks, for example. Don't attend if you are feeling sick in any way. You don't want to put others at risk, in particular your family members. In saying that, there is a lot of good news as our case numbers continue to drop in Saskatchewan, but the risk most assuredly has not gone away. So let's continue to be very careful. Saskatchewan is in a very positive spot compared to many other places in Canada and around the world. On a per capita basis, for example, our total number of cases is about 77% below the Canadian average, and our fatality rate is 95% below the Canadian average. This last statistic is largely due to the fact that we have not experienced outbreaks in our long-term care facilities. Across Canada, about 82% of fatalities have occurred in our long-term care facilities. The measures that we have in place in this province, such as staff only working in one facility, as well as the very significant commitment by family members that are not visiting other than for compassionate reasons, well, these measures are working, and they're working well. And I would like to say that I understand the sacrifice that is being made by families that are not visiting their loved ones in long-term care. The Saskatchewan Health Authority, as was mentioned the other day, is working on some parameters so that there can be some additional limited visitation occur in our long-term care facilities so that we can see our family members under some very stringent parameters. And we're looking forward to communicating these guidelines as soon as possible. I want to, on this note, once again thank the people of this province for doing what is necessary, whatever that may be, to flatten the curve and to, quite frankly, save lives in our province. We're doing very well. But we are entering a very sensitive period as well. More businesses are reopening in our communities. We're restarting some elective surgeries and many other medical procedures, and I know that we are able to do this. Saskatchewan has proven that we can do these things and that we can do them safely. But we all have to play our part to control the spread of COVID-19. The situation in La Loche continues to improve, as well as in other northern communities. So thank you to the tremendous efforts of community leaders, of our healthcare workers, of our public safety officers, and the many, many volunteers, and in particular to the individuals in those communities that are taking their personal physical distancing measures very seriously. The number of active cases in the far north is now down to 46, down from 156 just on May the 10th. If this trend continues, we are quite hopeful that by next week we will be able to start looking at removing the travel restrictions in northwestern Saskatchewan, like we have for many of the other communities throughout the north. Of course, this would only be done following consultation with community leaders, which is occurring weekly. Finally, if I could change gears for just a moment in summation. Yesterday, we began a search for our provincially appointed Saskatchewan Chief Firearms Officer. The job posting is up today and it closes on June the 10th. Our Saskatchewan party government will always protect the rights of the thousands of law-abiding gun owners in this province. With the federal government looking to impose new restrictions on law-abiding gun owners, we believe a provincially appointed chief firearms officer is an important step in protecting their rights. So I would encourage anyone who feels that they have the relevant experience to apply for this position. I'll now turn it over to Dr. Shahab for some introductory comments.
Thank you, Premier. So I won't go over the case counts, but they're in the news release and the Premier spoke to them. But I just want to emphasize that so far, Phase 2 appears to be successful, and that's primarily because of all the lessons learned when essential services were continuing to operate and when Phase 1 reopened. So personal care services, from what we have heard, continue to operate for the most part in a way that protects both staff and customers. And the retail environments also seem to be working in a way that all the lessons that we learned from grocery stores are being applied. But I would like the public to just think about, once Phase 3 starts on June 8th, how they will engage in a safe manner, because that's going to be a different environment. I think going to restaurants is going to be a different experience from shopping. So going as your household or your virtual household initially, so you're maintaining the same group, but then having the pleasure of actually eating out instead of taking food out. Just thinking through how do we engage in some of those activities that give us pleasure and support the economy in a safe way. And then, although our gathering sizes are going up for indoors from 10 to 15 and outdoors from to 30, I think just being a bit thoughtful about why are we having a gathering, how are we going to lay things out, how can we serve food in a pre-prepared plates, for example, and not have everyone kind of helping themselves either by touching the same spoon or by picking things up from a bread basket, for example. So I think we all need to start thinking about if we do choose to have a small gathering, keeping it as small as possible, and just thinking through how we can minimize exposures. And I think Phase 3 is going to be very important for us to maintain our case numbers low as that happens. And finally, we are getting a lot of requests for information, and as our municipalities, about playgrounds and outdoor sporting activities. That's really important for physical activity. We've already seen that you can do lots of things outdoors in a safe manner, but that's certainly something we'll be actively looking at in terms of some guidelines for those kind of outdoor recreational activities during the summer that can start as part of Phase 4 on a to be announced date. Thank you.
Thank you, Premier and Dr. Shahab. We'll now have time for questions. We'll take our first question on the line.
We have Phil Tank with the Star Phoenix.
Yes, I'm wondering if you can share any more information about the outbreak in Saskatoon, about those gatherings, about what portion of the 60 people, that represents people that come into contact with later or at the gathering. And I'm also wondering for both Dr. Shahab and the Premier, whether you think people should be fined in relation to those incidents. California.
So a couple of things. One is that when we have a private gathering where public health knows all the people who attended, obviously there's some reassurance to the general public that everyone's being followed up. And at this point, I understand there's potentially up to 4 cases linked to the 60 or so people who attended 2 related gatherings on different dates. But I think the lesson from that we all need to learn is that we need to be thoughtful whenever we have gatherings of any size, 10 or as we're going to go to up to 30 after June 8th. And secondly, obviously there's the possibility of issuing a ticket and fines, but progressive enforcement has worked well for us in the past. And in this case, my understanding is there's an attempt to understand why some of those considerations were not thought of when the event was planned. And certainly that's, all of us need to understand that, what are the guidelines, what are the limitations, and even when we follow those, what are some of the special precautions that apply. So I think we can update as further at a later date, but at this point I think it's more focusing on education. But having said that, if there are events where there seems to be a disregard of public health guidance, even when the guidance was given, the potential to issue a fine or a ticket is always there.
I would just add to that, the goal of the public health orders is to have compliance with the public health orders to reduce the spread of COVID-19. It's not to fine anyone. And although there have been some fines that have been administered over the course of the last few months, but those have only come about after a great outreach with respect to education, warnings, and then ultimately, if there still is not compliance with the public health orders, then there have been very few fines that have been administered by far and away. Normally, the education of the public health officials has been effective in ensuring that we are able to continue to reduce the spread of COVID-19.
Do you have a follow-up question, Phil?
Yes, I'd like to ask about minimum care standards for long-term care homes. I'm sure you're aware that the NDP opposition brought this up this morning, but of course this is a conversation being had all over Canada. And also they brought up the posting of the CEO tours of long-term care homes and the posting of that on the website.
Sure. Maybe I'll address the CEO tour first, and then the minimum care standards that have both been raised by the opposition here today. CEO report, where we've had CEOs in the previous number of health regions that we had, would go out, and starting in 2013, and it was an initiative that was brought in by this government, where the CEOs would tour each of the public long-term care facilities in their respective region. Since the amalgamation of the health regions into one Saskatchewan Health Authority. That tour does continue, although it is not always the CEO in every one of the public long-term care facilities that we have. It would be, however, some other senior official within the health authority or a VP, for example, that would be on that tour. My understanding is over the course of the last few months that in particular in health, but even across government, the focus of virtually everyone involved has been to ensure that we are addressing the COVID pandemic that the world is facing and that we are facing here in Saskatchewan. It's also my understanding that the past year's report is prepared, and it's very close to being ready to be released very, very shortly. With respect to minimum standards, minimum guidelines or minimum standards of care, if you will, the points put forward by the opposition just simply aren't true, and they simply aren't helpful. We do have guidelines for care here in this province. I brought them with me. There's 191 pages of guidelines, and I would just go to the very opening page about halfway down, where it says, and I quote, "The standards set within this manual are considered minimum standards." So we most certainly do have program guidelines for special care homes, which are considered the minimum standards here in the province. And we are very fortunate that these are working. They're working because we have a very, very competent and hardworking and dedicated staff in our long-term care homes across this province that are adhering to the guidelines and to the standards that we have. And they are doing a very good job, and that is showing in our numbers. In particular, our numbers of fatalities here in Saskatchewan due to COVID-19. And I do want to just put a statistic on of where we are here in Saskatchewan, and this is the deaths, the fatalities per million people. In Canada, we are sitting at 181 fatalities per million residents in this nation. Saskatchewan, we're at 8.5. In the U.S., is about 310 fatalities per million people, and the world average is about 46 fatalities per million people. So we are doing very, very well in Saskatchewan. As Dr. Shahab had stated the other day, that is in a large part because that we have not had the very, very difficult situation of having COVID-19 run through our long-term care centers. We know that 82% of the fatalities in Canada have come from long-term care centers. So much of that is due, yes, to the minimum guidelines that we have, but also to the adherence of the staff and the effort and the dedication of the staff that we have in each of our facilities across this province. They are literally saving lives in Saskatchewan, and they've proved it time and time again, and most notably, I think, in the way that we have had COVID in our long-term care centers, and it's only due to the hard work of our staff and the public health employees that we have been able to isolate that virus, isolate the individuals, do the appropriate contact tracing, and ensure that it is not running rampant throughout any of our long-term care centers. So a real credit to the long-term care staff that we have across this province.
We'll take our next question in the room. Steph?
Mr. Premier, I fail to see why public health inspectors wouldn't fine either the hosts of these two large gatherings in Saskatoon or some of the attendees, right? Like, the limit on gathering has been in place for about 2 months now. Both of you have been very clear on this one. By not fining individuals who violated this, aren't you sending a wrong message that, you know, as long as you get away with it, you don't get fines, but if someone tattles on you beforehand, you could have police enforcing things?
Our experience, I will just speak briefly, and then Dr. Shahab or Scott, if you want to add to it, but our experience has been by far and away that the vast majority, almost everyone in this province, is adhering to the public health guidelines and the orders that have been put in place. There are exceptions from time to time that we have dealt with. This is not the first exception that we have dealt with, and we reach out very quickly for a number of reasons. One is to ensure that we can do the appropriate contact tracing and testing so that we can isolate the outbreak or the numbers that may be infected very quickly. But two is to ensure that we are reminding all of those involved, whether they're the hosts or not, that this simply increases our risk of the spread of this virus. And as we said before, our goal is not to eradicate the virus. Our goal is to reduce the spread of this virus so that our healthcare system can manage it and so that we can reduce the fatalities here in the province. So that is that is how we have managed this time and time again. As I said, this is not the first time that we have engaged with an individual that either unknowingly or just thought maybe that we were beyond that point in time where we could loosen up a little bit quicker than we actually can. That we just continue to reach out to them, to educate them, and I think it's a reminder for all of us. It really is a reminder for all of us that this virus is here at least until such time we have access to a vaccine. The new normal is just that. It is a new normal, and we do need to pay very special attention to the public health guidelines recommendations that are put in place by Dr. Shahab. Do you have anything to add to that, Doctor?
The only thing I would say is that we are moving to phase 3, where gathering sizes go up to 30, and I think we just need to be conscious that even though gatherings up to 30 outdoors are allowed, we still need to be thoughtful about why are we having a gathering, what special precautions do we need to take to keep it as small and as safe as possible. I think we still need to be thoughtful. While that permission may be important for some special events, but even then, I think we still need to be thoughtful about having any gathering and thinking it through to keep it safe.
Follow-up, Stephanie?
Again, I understand that you don't want to fine people and be punitive with these public health orders, but, again, it's been 2 months. People know the rules. Why not take the opportunity to fine individuals who held these events, attended them, and I guess send the message as you start to move forward to phase 3 and eventually further phases?
Right. Well, we have fined individuals that have repeatedly not taken the advice of public health officials, and I would just say it isn't going to be me that is out fining individuals. There are public health officials that will be working with all of the individuals involved in this particular event, just like they have with other events that we've had in other communities as well. So the first step has always been to work with all of those involved to educate them, to ensure that they understand the risk is elevated. In this case, by a larger gathering size. The risk most certainly is elevated as the risk to infect a larger number of people, and ultimately have that larger number of people be in contact with an even larger number of people. The exponential infection rate can arrive very, very quickly, and we've seen that in other areas of this nation. We are seeing it most notably in Toronto and in Montreal as we speak. So this is being handled in precisely, to my knowledge, the same way that other infractions, if you will, have been handled. And our first step is to educate. Our first step is to work with all of those involved to ensure that they understand the seriousness of adherence to these public health orders. If there's a repeated, not following the public health orders, most certainly we would move forward with a fine, a monetary penalty, and that's happened in other cases. Anything else on that, Doctor?
And I think, the local public inspectors and the local medical health officer understand the content situation, are in the best position to either do education or progressive enforcement or a fine. So that's what's worked well in the past for other issues related to public health, and that's what we want to maintain with COVID-19 as we move forward.
We'll take our next question on the phone. Operator?
We have Jesse Anton with CBC.
Hi there. I'm wondering, in what part of Saskatoon did the gatherings that resulted in this outbreak take place? And I'm also wondering, what were these events? And if you can confirm if it was, in fact, a barbecue, like it was mentioned yesterday.
So because all the people who attended have been contacted and are self-isolating, it's not relevant to know which location an event happened. If it was a public event where many people went there was no way for public health to follow up, then a public advisory related to that would have happened, and we've done that in the past for other infectious diseases like measles, for example. And in this case, the only reason for mentioning it actually was to just remind ourselves of the fact that even when case numbers are very low and things seem to be very quiet, you can certainly get these transmission events. And just a reminder to ourselves that even when we have a private gathering and we think things are very quiet and we can do it even outdoors, and my understanding is that there were, and we'll get further information, but there were outdoor events linked to sharing of food. Transmission can happen, and I think that's the key message from this event, the key learning that even when case numbers are low, you can still get transmission. And as we go into phase 3, I think this is a good reminder for us to just be thoughtful about having any indoor-outdoor gatherings, having them as small as possible, and keeping them as safe as possible.
Do you have a follow-up question, Jesse?
Yeah, I'm wondering if the province or the Ministry of Health feels its messaging around reopening might have contributed to this outbreak in Saskatoon, and will the province be putting the June 8th date on hold because of it?
No. The June 8th date is, we're moving forward towards the June 8th date quite deliberately, given the numbers that we have here today. What has happened in Saskatoon, notwithstanding that there was a larger gathering than what there should have been, we are going to have continued regional outbreaks in settings similar to this as we move forward. And we are very confident that we have the testing and contact tracing capacity to ensure that we can keep those outbreaks at a very small level, if you will, to a portion of a community or a facility, or at least a community, and not have them extend across the province and be dealing with a province-wide pandemic. So no, the June 8th day for phase 3 is very much alive and well, and we are very deliberately moving forward towards that date, and quite confident actually in our ability to achieve not only an opening on June 8th, but a sustained lack of spread of this virus in the weeks, months after, given what Saskatchewan people have proved they've been able to do over the course of the last couple of months. Anything to add on that?
Yeah, I'll just say that, all of us have noticed over the last 2-3 weeks, there's more traffic on the roads. There's, a lot of retail environments, both essential and now as part of phase 2 reopening, are busier. There's, long appointment times for, getting a haircut, for example. And that's fine, but as long as these things happen in a way that are as safe as possible, and like the Premier said, there will be transmission events, either single, sporadic, or sometimes a cluster that need to be managed, and people need to feel comfortable stepping forward and getting tested, even if they have any concerns or even mild symptoms. And all of that will be important, and then quick contact tracing to get ahead of whether it's a single transmission event or a cluster. All of those things will continue to remain important as we move forward into phase 3. But at the moment, I think things look quite positive for proceeding with phase 3 on June 8th.
I had looked, just in addition to that, I had looked at our numbers of new cases throughout the month of May as we are getting near the end of May. The first week of May, we had 142 new cases. The second week of May, we were down to 51 additional cases. the third week of May, 40 additional cases. So we continue to drop. In this past week, the last week of May, down to 17 additional cases. So we have, Saskatchewan has done a very good job throughout the month of May in flattening the curve here, and we are very, very confident in our June the 8th opening of Phase 3.
We'll take our next question on the line. Operator?
We have Kayleen Sawatsky with Global.
Yes, hi, Premier. I'm just wondering if you can share what you will be telling Trudeau when you speak to him and the other leaders of the other provinces about what you want from the federal government to help with long-term care facilities.
Well, with respect, our ask of the federal government wouldn't be specific to long-term care facilities. However, there is some conversation around a broader ask, if you will, to deal with COVID itself, whether it be on the healthcare delivery side, the testing, contact tracing side, or whether it be on the economic side and how provinces, territories are being challenged on the economic side. I would note that the federal government has come forward with a suite of programs over the course of the last couple of months. Some of them have been timely, effective, and appreciated. Others have been, I think, timely, less effective, and really probably likely won't be discussed a whole big bunch in the days ahead, as they aren't addressing what they set out to address. Most evident among those was the ask for a liquidity program with respect to some of the larger businesses and in particular our energy industry in the province, which has, for all intents and purposes, missed the mark. And now the province will be working with that industry and other industries to ensure that as we find ourselves on the recovery of the economic recovery path, that we are able to ensure that our export-based industries are able to not only get back to the solid economic area where they were operating pre-COVID, but continue to expand and be part of achieving the plans that we had put forward in our plan for growth here in the province. So I just got off a call with the Council of Federation. The premiers will be discussing having a call with the Prime Minister, the Deputy Prime Minister, as well as other premiers from across the nation here in less than an hour, I suppose, where we'll be discussing just some of those items in addition to further efforts around contact tracing, increasing our testing, things of that nature, and look forward to it.
Do you have a follow-up, Kayleen?
I do, yes. I'm also wondering if you can just share your thoughts on the recent suicide of Samuel Uko, and if it's raised any concerns with you regarding mental health care in the province.
Always, anytime there is a suicide here, I think it raises concerns among everyone. First and foremost, I think I would extend my most sincere condolences to the family and friends of this individual. This is, a very challenging time for all those that were close to him. With respect to the mental health and addictions supports that we have in our communities, this is something that we have very much been committed to over the course of the last number of years. And in fairness, I think it's going to be something that we are going to be talking a lot more about in the years ahead than even we have in the years past. But we have increased our funding to mental health and addictions care here in the province exponentially over the last couple of years, and we need to commit to continuing to do that in the future, and not just to placing the funding, but to ensuring that funding is in turn giving us outcomes in our communities. And unfortunately, all too often, the outcome is tragic, as it was here this past week. So I would just close again in offering, on behalf of the government and myself, my most sincere condolences to the family and friends.
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Lisa, are you there?
Sorry about that. I wanted to ask if there's any idea yet on how much this preparedness and the whole COVID-19 response is costing the province.
That is a something that we have been looking at. It's very challenging to actually ascertain what that cost is. To the province itself, I think we'll come out with our best estimates on budget day as we enter back into the legislature on what we view the provincial finances will look like over the course of the remainder of this fiscal year. You will see then that largely we have been able to operate within the expense side of our budget, but the revenue side is going to be tremendously challenging, not only to ascertain exactly where that is going to be, but to actually work with our industries here in the province so that we are able to grow them back to a place so that they were pre-COVID, bring our residents and our communities back to work, and ultimately then start growing, as I said earlier, growing towards some of the targets that we had in our plan for growth. So the cost to date, the actual direct costs, if you will become somewhat evident on budget day. We've had, for example, the self-isolation program that we've put in place. There will be a cost there. We've had the small business grant. There will be a cost there. I would say the indirect costs will be much larger, much broader, and extend out for a period of time. And those will be costs, first of all, to the economy. In a large part, those are being borne by business owners across this province, across Canada, across North America, and around the world. But I would also say there will be an ongoing healthcare cost in trying to regain our surgical capacity and catch up, if you will, on the healthcare services that we know need to be provided in our communities. And we're very fortunate to be in a spot, thanks to the actions of Saskatchewan people, where we are currently charting a course, and we have reopened a number of elective surgeries. I believe we've done in excess of 1,000 elective surgeries already just in the past week or a little better, and are ramping up our surgical capacity to about 40% of what it was as our first phase of reintegrating elective surgeries into our healthcare system, understanding that we have throughout this time done any of the urgent or emergent surgeries that are necessary. So the costs are multi-pronged, and I don't know that they will be able to be accurately reflected in the short term. I think they are going to drag out over a number of months and quite likely years.
Do you have a follow-up, Lisa?
Yes, I'm wondering what you're hearing from people about phase 3, whether it's through the business line or other channels, because we are hearing from some businesses that say that some of the restrictions are a little bit too much, that they're not going to be able to operate.
We're working quite closely with a number of entities, and Dr. Shahab, you may have more to add to this as your office is intricately involved, but we are working with a number of entities with respect to phase 3, for example, restaurants, as well as some additional personal services. Also working with a number of community services, if you will, that may not be directly related to the economic recovery, but it most certainly are related to our own personal well-being and spiritual well-being, if you will. Working closely with a number of faith-based organizations, we'll be coming out with some parameters around how we will be able to move forward with some gatherings, some religious gatherings, if you will. And so we're the business response team and the Chief Medical Health Officer's office, as well as the Saskatchewan Health Authority individuals, are working very diligently with individuals so that we're able to open safely, but B, also an eye if there is a way for us to open and to ensure, understanding that many of these businesses have had a very difficult couple of months in not operating, that if there is a way for them to operate at the highest level of revenue capability, if you will, we want to do that. Healthcare is a priority, but our economic recovery is most certainly the goal as well. Doctor, anything to add?
Yeah, I'll just say that I think the feedback I received, also there's feedback that comes that if it makes sense as incorporated into guidelines that are updated, and we've done that in the past with, for example, how many people can be on a boat and those kind of things. So these will continue to evolve over time. The second thing is, although initially they sound quite significant, but I think businesses have, from what I've heard, is they look at their own setting and make plans that work for them in their layout, And I think that's really important, that a lot of these guidelines have to be applied in a particular layout, whether it's a restaurant or a gym, or as we've seen in the retail environment. Each retail environment is unique in terms of its layout, and there may be slight changes in terms of staying within the guidelines. How do you maximize safety but also efficiencies? And then I'll also like to say that right now we are in a good place to restart many things, but we have to remember going forwards there may be periods of time where in a particular part of the province or more broadly there may be an increase in transmission, and we also need to start thinking ahead now that how do we then adjust to that, either as customers who visit a business and certainly not visiting if you're sick, maybe taking additional precautions like using a mask, and how do we as business owners and operators then either continue to operate, or if there's some local guidance at that time, maybe slow things down or modify the way we're operating, if not required to totally close down, because as we've said in the past, we want to avoid as much as possible going into closing down as much as we can. But I think it's just something that we all need to now start understanding, that as we move forward, this is a good time, as there'll ever be, to cautiously move forward, keep our case numbers low, do our bit in terms of our personal gatherings to keep the case numbers low, but also start thinking ahead in terms of if we were to see a cluster or an increase in transmission locally, how would we all play a role in managing that while continuing as much as we can routine operations.
We'll take the next question on the line. Operator?
We have Mark Smith with CTV.
Hello. Testing numbers have increased quite a bit over the last few days. Has that been in relation to the expanded criteria, and do we expect those numbers to continue to rise moving forward?
They are up, but we're happy to see them up. As we have announced earlier this week, I believe the testing criteria has changed so that people that are working outside of the home can be tested if they so choose. So I don't know if Scott or Dr. Shahab would like to speak to the numbers and what you see as we move in the days ahead.
Yeah, I'll just make a couple of comments and then Scott may have additional, but I think from what I've seen, there's more calls going to 811, there's an increase in testing, but I think, like you discussed yesterday, we're certainly interested in seeing how does the trend hold out throughout the province in terms of an increase in testing throughout the province, and further analysis of what are the symptoms that people are going for, or what are the reasons people are going for. I think we need to continuously evaluate the outcomes of our testing criteria and adjust as we need to based on the epidemiology. Scott?
Yeah, and just following up with those comments, we are seeing an uptick, as you know, from Dr. Shahab's comments around 811, and these are individuals that fall into those new criteria that are driving a significant amount of that increased testing across the province. But as Dr. Shahab said yesterday, and he just reiterated, is it's early in the foray with respect to the new criteria. We'll continue to watch it and then analyze what we're seeing, particularly with respect to the test positivity rate, which was low, even though we had very, very broad criteria. But we are seeing more coming in. Just remind folks that it's both through 811, but also through family physicians and nurse practitioners that they can access testing across the province.
Do you have a follow-up question, Mark?
Yes. Has the CFL approached the province about being a hub city for games, and would the province consider it?
Yes, we would consider it, and I would suggest that if the CFL is considering something along the lines of a hub city, that Saskatchewan would be the place to have the Western CFL hub, just due to the strength of our organization and what we represent in the league. I won't go any deeper than that with my loyalty to our beloved Rough Riders. The fact of the matter is we have not had direct discussions with respect to what that would look like going forward, or specific discussions, I guess. But we are very hopeful that we would be able to move forward with some type of CFL season here, not just in Regina or in Saskatchewan, but in general. As we know, we do. For many, many years, that has been our only professional team in this province, and it's a team that is very beloved to all of us. So we are hopeful that we'd be able to move forward with some type of a league games here this year, whatever that would look like. In saying that, it would have to be safe for all involved, safe for the players, safe for all the associated team members that would be involved, and likely wouldn't include fans in the near future. So I think there are discussions that do continue more at the health level, if you will, than the political level. So Dr. Shahab, if you'd like to say any words to that.
Well, I think, again, if there's any specific details, we can work that out. And
it is a workplace. The CFL would be considered a workplace. There's a number of workplaces here in the province that have worked throughout the pandemic with significant numbers, but they've put in place the appropriate precautions to ensure that even in the event that there is a COVID-19 case, that they're able to isolate it and to control the spread in those instances. We've seen that in urban center workplaces. We've seen it in mines. We've seen it in many workplaces, not only in Saskatchewan but across Canada. So if the proper and appropriate precautions are put in place, it's quite likely, I might add, that our Saskatchewan Roughriders would not only be able to host the Grey Cup in 2022, but if we're able to be in a winner-host scenario this year, it's quite likely that if we were able to play a few games, that we would likely host this year in Regina as well, and that's a real positive for not only the CFL but our winning Saskatchewan Roughriders.
We'll go back to the room here. Steph?
Yeah, Mr. Premier, do you think that the liquidity you're asking for the oil and gas industry is being given enough priority by the federal government? Because we haven't heard them talk about this for a while. They're focused on long-term care homes. There's a lot of other asks from provinces. Right. So do you think that specific one is getting the attention it deserves?
Well, I think the attention that was there, I think the program missed the mark, if you will. The program that they'd come out with, the LEAF program, as well as the BCAP program, I think missed the mark for the energy industry in particular. I'm not sure if there's other large businesses that will be making use of that, what is essentially a loan program. I'm not sure if the major airlines are going to be making use of that program either. So for the most part, I think the program and the effort was there with the decision either at the political level or wherever. It just simply isn't going to be useful for the energy industry. Thankfully, prices have rebounded a bit. They're in nowhere near profitable territory. But they have rebounded a bit, and we're working very closely with the energy industry on is there some opportunities for us to work together to ensure that they can get to a profitable state quicker, and then really rebuild post the COVID pricing challenge that they have had. In saying that, the abandoned well program that the federal government has put forward and provided the funding to the provinces, and the provinces are administering that with the industry, and we've worked quite closely with the industry on the $400 some odd million that is allocated to Saskatchewan. We're quite appreciative of that program. As you know, that was asked for a number of years ago by the former premier, and that is getting people to work in the service portion of that industry and getting them to work very quickly. So we are quite appreciative of that segment of funding that has been provided by the federal government, which is really a win-win-win. It's a win for the provincial government, it's a win for the workers that are going to work, and it's a win for the environment as well, as we are cleaning up abandoned wells in the province.
You have a follow-up, Steph?
Yeah, whether or not it's on your priority list, I mean, the Prime Minister's indicated on this call he's going to be bringing up support for long-term care homes, or that he's willing to help for long-term care homes, as well as paid sick leave for employees. Like, what form of help do you want on either of those fronts, and I guess, do you even want that kind of help for Saskatchewan from the federal
I think what
government?
you'll see on the long-term care home front is really there are some very significant challenges in portions of this nation. We're very fortunate here, and I spoke to the guidelines and the standards that we have in place, as well as the staff that are working very hard. We've had the ability to cohort those staff so that they're only working in one facility, not working in multiple facilities, all reduce the risk of spread to those in our long-term care homes that are most vulnerable. And that's bared out across the nation, and it's bared out in our low death rates. So very fortunate for a number of reasons. We had some time to react with relative to what some other provinces had with the how the COVID-19 spread throughout their communities. So the ask I think you're going to see, or the conversation from all provinces, is that there does need to be some pandemic funding that flows from the federal government to the provinces for various issues. The issues and challenges are different from province to territory, and so that's a discussion that has been ongoing and will most certainly continue. With respect to the wage subsidy, the sick leave, also a discussion that has been on the Council of Federation call as well as the First Minister's call, and I expect it will be on the First Minister's call here later today. And I would just say, with respect to that, first and foremost, there can be, if the federal government is moving forward in this area, and they've indicated they are, there can be no cost to businesses. Businesses have borne a tremendous expense over the course of the last couple of months, and there can be no cost to the businesses that are just trying now to dust themselves off and reopen and get back into the marketplace. And no ongoing cost as well with respect to increased EI rates in years down the way. Second, I would say that it should be time dated. Collective bargaining is where these types of conversations around sick pay should occur. But if there is something that is COVID specific, that should that could happen if the federal government chooses to do so. But it should not be distorting the marketplace, as collective bargaining is where those discussions should occur over the longer term. But understanding that we are in some unprecedented times here today. Last would be the fact that if it is a federal initiative, it needs to be funded federally. All too often, we've seen a number of these programs that have come out without provincial or territorial consultation, albeit that is getting better as we go through the weeks. That if this is where the program is announced and then the province is required to either administer it or to participate financially. So as if this is a federal initiative, then it needs to be funded federally as well.
And we'll take our last question from the phones. Operator?
We have Morgan Majeski with CBC.
Hi, folks. Thanks so much. Do you feel that guidelines around gatherings, like barbecues, have been made clear in all languages? There has been some criticism that a lot of the government communication has been in English. What's out there for non-English speakers, like newcomers, for instance?
Yeah, I think that's a good point. We have looked at some other provinces that have made some very simple guidelines in other languages. So that's a good comment, and I think we'll look again at our website and other products that are on social media and see if we can be a bit more clear. So thank you for that.
We also, as we were addressing, and I'm not sure if they're still running, they may be, but some of the education initiatives and the communication initiatives that we undertook in our provinces north, we had taken up a radio taken to the radio airways, if you will, in 4 different languages that would be recognized by various communities across the north. So there has been some initiatives and efforts made with respect specifically to the northern parts of the province, but your point around new Canadians and Canadians where English is not their first language is well taken.
You have a follow-up, Morgan?
Yeah, I do. So I'm just wondering, why is there such a high level of secrecy from the government of Saskatchewan when it comes to kind of death locations and case locations? We've been asking for a while to get more information about the locations of these cases, but the government hasn't been offering it up. Why is there such a high level of secrecy within the province when it comes to the location of these deaths and also the location of the outbreak here in Saskatoon?
So a couple of things. One is that for deaths, we have said in the past that the virus is the same wherever it is in Saskatchewan. And when you get an unfortunate outcome like a hospitalization or death, it's very tragic. And there's no value from a public health perspective or a public risk assessment perspective or knowing where a person lived who unfortunately passed away. So that's the first point. And secondly, we also need to make sure that we respect the privacy of individuals and families who may be hospitalized or may have passed away. Having said that, I did provide a summary yesterday of the age ranges of the 10 deaths we've had and a summary of the age ranges of the hospitalization and ICU admissions, and flagged that we have seen hospitalizations in every age group, but ICU admissions seem to be more frequent in 50 and over. So that's just something you need to keep in mind, and of course, if you have underlying risk factors. Second thing I like to say is that initially when we had few cases, obviously it was very challenging to identify cases by community, and we were always emphasizing that just because a case is in community A doesn't mean that community B is COVID-free. And time again, we've seen that with our sporadic cases throughout Saskatchewan, while they're low, they do pop up anywhere, and there's usually no indication of where the exposure happened. If it's the first case, there may be secondary cases linked to the first case. And that's just a reminder that we see low levels of ongoing transmission, either asymptomatic or mildly symptomatic. We're hoping the expanded testing criteria will further let us find these early or mildly symptomatic cases and further inform our reopening plan and what mitigation we need to do individually and at a community level. And we will be working on a map that may have a bit more detail than our current map, which will allow all of us, as our businesses reopen, that do we need to modify behavior because we have a bit of more activity. And so we learned a lot from the experience in the Northwest, where there was significant hardship for people who were impacted by travel restrictions and other restrictions for access to non-essential services, where reopening plans were delayed. But I think we need to apply some of those lessons learned moving forward, in which we minimize as much as possible any disruption to allowed businesses, but where needed, we are able to modify our own behaviors and how we engage when we're outside the home when required. So we will be providing an updated indicator list that will inform all of us in terms of how is reopen plan proceeding and what are any precautions that may apply, either at a smaller geography or more broadly. So,
Thank you all for taking the time to join us. That concludes today's conference.